Hello and welcome. Today, we're diving into a common, yet often misunderstood condition, sinusitis. We'll explore what it is, what causes it, how it affects you, and what can be done to manage and prevent it. So, let's get started on understanding sinusitis. Sinusitis, at its core, is an inflammation of the sinuses, those air-filled pockets in your face that connect to your nasal passages. Now, what kicks off this inflammation? The causes are varied. Viral infections, like the common cold, are frequent culprits, leading to acute sinusitis. Bacterial infections can also be responsible, sometimes as a secondary infection after a viral illness. Other contributing factors include nasal polyps, those soft, painless growths inside the nasal passages, a deviated septum, when the wall between your nostrils is off-center, allergies, which trigger inflammation, and even certain underlying medical conditions or immune deficiencies can increase your susceptibility. Let's talk about the how of sinusitis. Normally, your sinuses produce mucus that drains into your nose. This drainage helps to keep the sinuses clean and clear. But when the sinus lining becomes inflamed, usually due to one of the causes we mentioned, the drainage pathways become blocked. This blockage creates a breeding ground for bacteria or viruses, leading to infection and the characteristic symptoms of sinusitis. The inflammation also causes the sinus lining to swell, further obstructing drainage and increasing pressure. Sinusitis is incredibly common. Acute sinusitis, often linked to the common cold, affects millions each year. Chronic sinusitis, while less frequent than its acute counterpart, still significantly impacts a large portion of the population. Factors such as allergies, exposure to pollutants, and smoking can increase your risk. The prevalence varies with age, with children and older adults often being more susceptible. So, how do you know if you have sinusitis? The symptoms can be a real nuisance. Common signs include facial pain or pressure, especially around the nose, eyes, and forehead. You might experience a stuffy or runny nose, often with thick, discolored mucus. Other symptoms can include a decreased sense of smell or taste, headache, fatigue, coughs or throat, and even bad breath. The duration and severity of these symptoms can vary depending on whether it's acute or chronic sinusitis. Diagnosing sinusitis typically involves a physical exam by a doctor. They'll assess your symptoms and examine your nose and throat. In some cases, they might use a nasal endoscope, a thin, flexible tube with a light and camera, to visualize the inside of your sinuses. Imaging tests, like a CT scan or MRI, might be necessary for chronic sinusitis or to rule out other conditions. Allergy testing may also be performed to identify potential triggers. Sinusitis can be broadly categorized into acute and chronic forms. Acute sinusitis usually lasts for up to 4 weeks and often follows a cold or flu. Chronic sinusitis, on the other hand, persists for 12 weeks or longer, despite treatment attempts. There are also recurrent cases of acute sinusitis that may eventually need intervention. Treatment for sinusitis focuses on relieving symptoms and addressing the underlying cause. For acute sinusitis caused by a virus, decongestants, nasal saline rinses, and pain relievers can provide relief. Bacterial infections often require antibiotics. Chronic sinusitis management can be more complex. Nasal corticosteroids, either sprays or oral, are frequently used to reduce inflammation. Antihistamines can help manage allergy-related sinusitis. In some cases, such as endoscopic sinus surgery, may be necessary to improve drainage and remove blockages. While you can't completely eliminate the risk of sinusitis, there are steps you can take to minimize your chances. Practice good hygiene, like frequent hand washing, to prevent viral infections. Avoid smoking and exposure to secondhand smoke. Manage allergies effectively, and use a humidifier to keep the air moist, especially during the winter months. Regular nasal saline rinses can also help keep your sinuses clear. The prognosis for acute sinusitis is generally good, with most cases resolving within a few weeks with proper treatment. Chronic sinusitis can be more challenging to manage, but with a combination of medical therapies and lifestyle modifications, many people can experience significant symptom relief and improved quality of life. Recent research is exploring new medications and surgical techniques to better manage chronic sinusitis, including targeted therapies and minimally invasive procedures. Ongoing research is also focused on understanding the role of the microbiome in sinus health.